Okay, I'm going to be demonstrating how to do trach care. So I've gathered all my supplies. Knock knock, entering the patient's room, providing privacy. Hi Irina, my name is Marilyn. I'll be your nurse today. Looks like there's an order to perform some trach care on you. Gonna clean you up. Is that okay? Okay. 2 patient identifiers. Irina tract. Date of birth, perfect. All right. So I have my supplies here. I would wipe the table. Clean, clean, clean. Put my supplies right here. All right, Irina, I'm gonna raise your bed to a good working height, and I'm also gonna put you on Fowler's position. All right. That's pretty good. You have your O2 sensor on. And then I'm gonna don a mask. Alright. So you're good, you're in position, explain procedures. Okay. I'm gonna open the sterile container. Like that. And then looks like there's this. I'm gonna use this as my sterile field. Like that. Okay, I'm gonna pour some sterile saline into this compartment right here. Perfect. Place this here. Clean my hands again. Don clean gloves. Okay. All right, Irina, I'm gonna remove this or loosen this oxygen source and pull it like this so that you're still getting air, but it's not in the way. Then I'm going to, in a counterclockwise manner, remove the inner cannula. Okay, and then this is gonna go into the solution. Perfect. And then I'm gonna remove this gauze right here. Gonna slightly loosen this, remove that gauze. While I'm doing this, I'm going to assess the surrounding area for any redness, irritation, or anything. This is going to be thrown away into the trash. Okay, perfect. So that's been done, assessed. Moving on to over here, gonna remove the clay gloves. Clean my hands again. And I'm gonna grab the sterile gloves. And then pinch. And scoop. These are not my favorite gloves. They're a little hard to put on. Okay, so once I'm here, I'm going to proceed with cleaning that inner cannula. So it's been soaking in the solution. With my sterile gloves, now I can touch the contents in here. I'm gonna be scrubbing the outside of the cannula. Clean, clean, clean. Perfect. And then I'm agitating it in the water to rinse. Rinse, rinse, rinse. Using this pipette, I can dry it, clean around. Okay. And I can pat it dry on some gauze. So tap, 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 pat, pat, pat. Okay, now this will be going back into the patient. Making sure to not contaminate and touch. Alright, this one clicks into place. So inner cannula has been replaced. Next, I'm going to be cleaning the surrounding area with some cotton swabs that have been soaked in some saline. So, cleaning the area and with approved solution per hospital policy. Cleaning, cleaning, clean, 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 clean. Alright, the surrounding area has been cleaned. I would throw it away, but for saving purposes, I'm going to be reusing my kit. Put it right there. So, inner cannula has been cleaned. The area around the cannula has been also cleaned. Next, it's time to replace this dressing. So kind of like that, and then tucking this underneath. Sorry, sir. Man. Okay, there you go. So this dressing has been replaced, and then next would be these drawstrings. If they were soiled, I would replace. So I have it here. You never want to replace, just completely remove this when replacing this. You want to kind of keep it on. And so, going to loop this through, kind of like that. And then I'm going to lift you up just slightly so I can bring these back. Okay? And then, yeah, okay. And then I'm going to loop one through here. Perfect. Now it looks like I can remove this old one. So this is the old one. It would be disposed of in the trash can. Then I would tie this one. Okay, so that's been replaced. I would put the oxygen back on. There you go. Does that feel okay? Awesome. Okay, and then I would remove my gloves. I would throw them in the bin, again keeping everything. I would discard all my supplies, clean my hands, and then I would make sure to document the patient's tolerance to the care, any drainage that I saw on the gauze, any sputum, and I would also assess the respiratory. I'm just gonna listen to your lungs real quick and check your O2 stats. Okay, above 90 looks good. Gonna give a little listen. Okay. Respiratory assessment looks good, so I would document that. And then I would reposition you back to normal. So bend low, and then back how you were. Is this okay? And then any pain that you're experiencing, if you need to help with the restroom, okay, call it within reach. And I believe that's everything.